Hey, everybody. Welcome to Gross Anatomy, where we discuss the sights, smells, and sounds of medicine, how it relates to movies, TV, pop culture, books, podcasts, and the world around us. I'm joined by
Lauren Taylor.
And here we are.
Here we are.
Here we are. Are we live, Lauren Taylor?
We are live. It is Ash Wednesday. Being
Yes.
a Catholic, I do remember that. And also, we wanted to mention the Pope a little bit. I have some questions for you.
Oh, good tie-in. I love that tie-in of Ash Wednesday and the Pope. I love it. I haven't heard the latest news today. Have you?
Yeah, so today it was good news. He was in an armchair. He blessed the ashes. He called some parishes. So I think he's kind of up and around.
Yeah. You know, as a doctor, it's interesting. As a doctor, hearing about his illness, and it's interesting and weird and strange that the whole world, you know, it's almost like he has no privacy. Like there's no HIPAA, there's no patient confidentiality with the Pope. You know, everybody knows what's going on, but which is a weird thing. But having taken care of people his age with his medical conditions, you know, bad lung infections, you know, needing to be on oxygen, and then having other parts of the body not doing well, you can't help to wonder and think, as someone who's trained and been through intensive care, it's pretty serious. You know, however the media is painting this to be, this is definitely probably as serious as it gets. And you know, hopefully he's going to pull through and he's going to be okay. But you know, as a doctor and seeing this happen time and time again, you can't help wonder, is there a chance he may never make it out of this stage, you know, of just being chronically sick and then eventually succumbing. Right. So it's weird, you know, hearing about it, and you don't hear newscasters talking about it, you know, what it really means in the prognosis. So it's a bizarre thing.
No, you don't. And so I didn't realize he's 88 years old, and he already had like a portion of his lung removed after he suffered a respiratory illness, like in 1957 when he was a child. So I imagine that's adding to it maybe, or I don't know how that works.
Yeah, definitely. So he has less lung volume, you know, he has less lung, you know, and we need our lungs to maintain certain oxygen to be able to function and be aware and awake and function everyday stuff. So he's already functioning on less lungs. So it definitely will be an issue. And then he already has supposedly bad lung disease. So, you know, it's the kind of thing where, you know, we often talk about, you know, especially someone who's elderly, but anybody in general, you know, it's like it's okay. A lot of people could do okay with one hit and bounce back after one hit. But if there's like a second insult or injury on top of that, especially in someone who's frail, that's not a good prognosis. So, you know, he's got to be really frail, but hopefully, you know, God willing, he's going to pull through.
Right. Well, so this might be a stupid question, but it says he was admitted with polymicrobial infection, and then it also said he had pneumonia in both lungs. Is that part of that infection? Is that the same thing?
Yeah, pneumonia is basically an infection or inflammation of the lung, some sort of inflammation of the lung. So, and his is polymicrobial, meaning more than one type of organism, whether it's a bacteria or a fungus or a virus. It's probably multibacterial, causing the infection in his lungs. It is probably, and then sometimes, you know, depending on how severe it is, it could escape to other parts of the body, and that could be worse. You know, it could cause what's called sepsis, which is a total body shutdown, you know, and widespread infection. So, but it sounds like his main issue is really just being able to get his lungs back and functioning okay and clearing the infection, I think and hope. You know, I'm clearly not one of his doctors, and I'm not a lung specialist, and I haven't done intensive care unit treatment in a long time. But just as, you know, as a doctor, having taken care of people in the ICU, I just, you know, it just is interesting. The Pope has no privacy, you know, when it comes to that.
But yeah, I guess he entered willingly into a life like that. He seems to love being around people more than other popes I ever remember seeing. And
right.
So,
Right. Yeah.
but speaking of that, and kind of segueing into the Oscars, which we both just watched, I think. Um, did you watch Conclave?
No, and it's on my short list of movies that I do want to watch, but there's just so much good television now. So
Mhm.
we haven't made time, and unfortunately, we watched some crap that I wish I hadn't watched. We'll talk about it. So no, have you seen Conclave?
I have. I think it only won for like best adapted screenplay,
Right.
but I could be wrong. Yes, I liked most of Conclave. I'll just put it that
Right.
way.
But the actors are phenomenal. I mean, that's what looks. That's really what I want to see. I mean, the cinematography and all the shots, and then all the actors are like, wow. That's what excites me. I remember seeing the trailer in theaters, and I was like, I need to see this. Is kind of how I felt.
That's how I felt too. That's like one of the few movies we saw last year in theaters. So
Yeah.
I think it's worth a view.
Yeah, it's on my list of movies to see. I hopefully we'll get around to it.
Well, so you watched the Academy Awards or you didn't?
I must confess, I did not watch the Academy Awards. I watched some clips, certain clips of the Academy Awards. I watched a few clips. The clip that I watched really more than anything was the Adam Sandler clip.
Mm.
just because I had heard about it, and I wanted to see, what that was all about. Because I'm a big Adam Sandler fan.
I think that was the best part. So I think you got the best of it.
Really?
I mean, yeah. Normally I just watch clips too, but my mom was in town. She wanted to watch it, and it really did seem to go.
Shout out to your mom. Let's shout out to your mom.
Shout out Debbie. Yeah. So
hi, Debbie.
But it went on for a really long time. But you wanted to talk about the substance, so I thought maybe you had something you wanted to say about Demi Moore not winning.
Did you watch The Substance?
I haven't. So we watched alternate things. You tell me.
Don't watch it. I must tell you that, and that's what I mean. I'm a big movie fan. It's why we have Gross Anatomy podcasts. It's why we explore the sights, smells, and sounds of medicine, how it relates to all this stuff. I have to tell you, I think The Substance might have been one of the worst movies I've ever seen in my entire life. It was the hugest waste of time. I kept waiting and waiting for it to kind of get better. And the only reason I was watching it is because I knew Demi Moore, everybody talked about her performance. Mm-hmm. So I was like, okay, I'll watch it because I love Demi Moore, especially from G.I. Jane. I think that was a Oscar nominated worthy role, G.I. Jane. And so that was really why I watched the movie, because I'm a Demi Moore fan and I wanted to see this great piece of whatever. And I just think it was probably one of the worst written, the worst directed, not even greatly acted. I mean, Demi Moore, I don't know. Maybe it was good costumes, but even though just everything about it was just dumb. And I'm so upset. And I because finally the last 15 minutes I got up and left. We watched it at home with my brother-in-law and sister-in-law, and we're watching it. And finally, the last 15 minutes, I was like, no, I'm done. And I got up and I went to bed. And I never do that. I you know me, I love movies. I didn't even watch the last 15 minutes.
Do you think so? Did the females watching it with you have a different perspective?
I think they thought it was horrible too.
Wow.
I don't even know if they both finished watching it. And I know, Demi Moore got all this. Partly, I think it's because people like her, and the whole Bruce Willis thing, and she was amazing in G.I. Jane. And I think people are like, I think it was kind of like a.
Yeah, but it should be about
an honorary Oscar, an honorary nom. Because didn't she win a SAG award or something for it?
So I think what started this whole thing was she won a Golden Globes, which have like two different categories, like musical, which is usually never musicals win, and then like drama, more people have a chance to win. So she won for that, and she gave an amazing speech about very pro women and like being who you are and all that stuff. So people loved it. I feel like that helped her award season.
Yeah, and she's fun and she's great. I'm a huge fan of hers, and so, but even like, I don't know what they were trying to do. Like even like the medical part of it, even though it was like medical fantasy stuff, spoiler, the alter ego comes out of her back, and then the alter ego knows to suture up the back, so that she could be okay. And then she gets her life source by, I guess, lumbar punctures, spinal taps, to get spinal fluid, presumably, to put in. And it was just...
Well, that's very medical, though. Did she do it well? Did she do the sutures right? What about the spinal?
No, because it wasn't even Demi Moore who was doing the suturing. It was the alter ego. I thought the other actress did a really good job too. Just as good as...
Is it Margaret Qualley? Is that
Qualley? Yeah.
Oh, okay.
I thought she did a phenomenal job also. More, almost better than Demi Moore. I mean, Demi Moore just played like desperate. It wasn't... I mean, G.I. Jane was phenomenal. I that's kind of my gold standard for Demi Moore. But and I loved her. Whether it was A Few Good Men or St. Elmo's Fire or
A Few Good Men. I forgot about that. I could have seen her winning supporting actress for that.
Yeah. But this movie, it was dark and going dark and all of that. But it was just... the problem is it was just such a bad movie that I don't even think it should have gotten any nominations. And I think the reason it did is because the whole body dysmorphia, aging, and I think it kind of just seems like a tribute nod to the Oscars is kind of really how it felt.
Well, I've been a little scared to watch it since it's like body horror. I'm like, how much can I take? But I mean, if you were able to handle it, maybe I can handle it.
Yeah, it wasn't. It was just like, I thought there was no comedy, there was no humor, there was no, I thought maybe it could have gotten even cooler, surreal, and it didn't go any... I don't know. I'm no Siskel and Ebert, but I'm totally dating myself. But
I don't think you were alone in that. I mean, I think that one only won for best makeup, which is all I voted for it in my aunt's pool, because I read something Margaret Qualley said, like her skin, it took a year to heal from the makeup they put on her. So
yeah, at the end, the final stuff was kind of cool, but it was just like, it was a big disappointment. And I told Hannah, my middle daughter, I told her she wanted to watch it too, and I told her that it was a waste of time. I told her I hated it. I think she watched it. I need to kind of get her full feedback on what she thought of it. I'm not totally sure, but I'm a major thumbs down. Probably worst movie ever for me.
Wow. Okay. All right, then I'm going to put that one on the back burner and Anora on the front burner. I want to see that.
I didn't see Anora. Did you see Anora?
I haven't seen a lot of the...
No, me neither. Yeah, to me, Anora is kind of Pretty Woman, which was a fun movie. So I didn't see it, but I'd like to see it. Not necessarily more than other movies. Like, I'd rather see Conclave, I think, first. But
yeah, I'd be interested to see what you think of Conclave.
Yeah. But Anora looks interesting, and yeah, I don't know.
All right. Well, you didn't really miss anything in the Academy Awards. Let's just say that. So
we already talked about A Complete Unknown, right? Didn't we discuss that already, or we never did?
Yeah, a little bit. I still haven't seen it. I think I voted for him to win, and he did not. Yeah.
And then the only other, should we circle back to other movies or talk about, the other movie that I thought that wasn't nominated was the movie Blink Twice. That was kind of on my list of movies that the trailer, did you see the trailer to Blink Twice?
Yeah, I was so surprised when you text me Blink Twice. I was like, that's a movie I wouldn't think you would ever watch.
And based on the trailer, I would never have wanted to watch it because it looked like kind of really spooky and scary and kind of like Midsummer, that movie, which I would never want to watch. And it was surprisingly not horror scary. It was kind of a little thriller, weird, wacky, but it was really, and that was written and directed by what's her name?
Zoe Kravitz.
And that I thought was not the greatest movie, but I had low expectations. I thought it was going to be scary, and it was fun, and it was done really well, and especially as a first time, it was beautiful, and I thought, and it definitely has some dark stuff to it, but I like crazy dark stuff. but it was not horror. It was done really well. It was really entertaining. So I highly like that. Would be a great airplane movie, I think.
Okay, I will rethink watching that movie then, and I'm sure she's going to be directing more.
Because I'd love to hear your thoughts. But Zoe Kravitz wrote and directed it, so way to go! Like she knocked it out of the park, especially compared to The Substance.
Wow! All right, so she's a real deal director. That's cool.
Yeah, I think so.
Nice.
Yeah.
Well, going back to the Academy Awards, I guess one thing you missed was Morgan Freeman paid a little tribute to Gene Hackman, which I thought was nice. Because he had just died like 4 days before or something, 5 days before.
Yeah. Of crazy.
Nobody knows.
This week was a weird week and sad week in deaths, I think, right?
It was, where deaths are either like undetermined or they're just not going to be disclosed.
Right. And so he it turns out was found, he and his wife and dog, right? And dog were found having been dead for like. So
they still don't, I don't think they have an exact timeline. So he had a pacemaker. It says his last event was recorded on February 17th. So I guess.
Which was 10 days before, right? Or 2 weeks before, right?
Yeah. I mean, they were found dead in their home on February 26th. But then
so a week, whatever, yeah. So, but then I saw that someone said they're mummified, right? That they're like rigor mortis and everything.
Right. I think that was just like a buzzword to click. I mean, I don't know. You explain mummified. They made it seem like mummified meant like they were there for weeks. And then when you read further, it was like mummified could be just like 4 days. I didn't really understand it.
But rigor mortis is basically, they were, fully cadaver, but it's crazy. And the cause of death is still unknown, right?
It's still unknown. So he was found, he had a cane. He was found like by the mudroom, dead. She was found in the bathroom. There were pills out, dead. Their dog, who they said was a German Shepherd, which they got wrong, it was not a German Shepherd, was found like in the bathroom closet. It was like 12-year-old dog, I think, dead.
In the closet?
Yeah.
Oh, so it's really bizarre.
Yeah. So it's like, and they were obviously dog lovers. So if I think, you see pills, you're like, oh, she killed herself. But I don't think that you do that to a dog. You don't.
Don't. And why would you put it in the closet? I don't know. Unless they have a giant, beautiful closet where their dog bowl is. That sounds really strange. I didn't even know that.
Well, 2 of their other dogs were still alive. But yeah, so they still haven't figured it out. So I have no idea. I mean, I first thought like carbon monoxide poisoning, but they ruled that out.
Right. That's, I think, what came to mind. It's got to be some substance that's in the air or something to knock them both out.
Well, I'm curious, like, if you have a patient and they're deceased and the doctors don't know why, what do you write on the chart? Just unknown? And like send it to an autopsy?
Yeah, often you'll do an autopsy. You get an autopsy, and based on the autopsy, then we'll get a sense of, they'll look at the heart. Often, I remember when we used to have to fill out, back in the day when I was a resident, we had to fill out death certificates, when our patients would die. And one of the main thing we would often put is cardiopulmonary arrest, which basically just means the heart and lungs stopped. Mm-hmm. Sometimes that would be enough, but sometimes, whoever was in charge of that, I don't know if it was the medical examiner or whatever, we'd get a phone call saying, no, you got to say something else, so it would be like respiratory failure or sudden lung, acute respiratory distress syndrome, or, but usually the final cause of death was often, cardiopulmonary arrest, the heart and lungs stopped.
And so since no foul play was detected, that was enough usually.
I think my guess is, I'm so far out of this stuff that I don't know. Okay. But I wonder if they aren't going to do the death certificate until they get the medical examiner's report, and then they'll fill out the death certificate. I don't know if that. I'm totally guessing. If I got to tell you, I'm embarrassed. Not that embarrassed. I'm not in that field, but I think that's might be what's going to happen.
Or you're a really good surgeon that doesn't ever have to fill out death certificates, which is nice.
Thank God. Yeah, that's definitely a good thing. I thankfully I haven't had to do that, but as residents, we had to do it all the time. Yeah, it's crazy, and even as med students, I think we had to help fill them out. But during our residency, we really did a lot of that.
Do doctors like usually request an autopsy, or is it the family, or it's both?
That's an amazing question. One thing we learn in medical, when we're med students and residents, is one of the things like our attendings are always saying to us is always try to get an autopsy on your patients who die, for the learning, for the teaching and the learning, which is a weird, interesting thing. They're always like, "Did you get an autopsy? Did you get an autopsy?" So we used to. That was one thing that was often encouraged by our attending doctors as residents would be to try to see if the family's willing to allow for an autopsy. Usually, it would be the doctors requesting it, unless it was like a weird foul play kind of thing or something gone awry, then maybe the families would ask. But sometimes, if it's a medical examiner case, if there's a possible like a felony involved, some kind of like trauma, or someone shot someone or stabbed someone, then it automatically goes to autopsy.
Right.
It's a medical examiner case. If there's known foul play.
Right. Because I was assuming if there's foul play, then they have to have control over the autopsy. Because I read a family can reject an autopsy for religious reasons, but I'm sure not if there's foul play.
Yeah, I think if there's foul play, I don't know what the rule is. Can you reject an autopsy? I'm not sure. And maybe there's like limited autopsy things, maybe you don't do the whole thing, but I don't know how that works these days. But yeah, theoretically, according to Judaism, at least from what I remember, back in my learning, is Jews aren't supposed to have autopsies. They're supposed to be buried whole immediately. Within. The interesting thing about the Orthodox belief of death is that you bury that body immediately. As soon as possible. In the daylight. So if someone dies at night, the funeral is the following morning, according to Orthodoxy. There's no like waiting around for a week or the yada yada. You die that day. They try to bury you that day because it allows the mourning period to start right away, so the family and everyone could start mourning. But theoretically, it allows the soul to be able to, to be set free, so to speak, and to be able to go, into the afterlife or whatever it is. Whereas it's respect for the body by burying them right away.
So I have a question for you. It's probably more of like a TV episode question that you would write this for. But have you ever had a patient's family try to like stop you from doing a surgery for religious reasons? Have you ever
doing a surgery?
Yeah.
Never like dramatically, as we're wheeling the patient in. It's never been like a dramatic thing, but not so much. I've taken care of a lot of Jehovah's Witness patients who will not consent to blood transfusions. Right. So definitely have had complex surgeries that we've had to do under knowing that this patient may die if we lose a lot of blood. And luckily, that hasn't happened, or we do everything beforehand to optimize. And it's possible there have been some cases in the past, it's been a long time, where we said, no, we can't operate if you're not letting us, potentially do a blood transfusion. It's just not, the patient won't survive. So
I did not know that's where we were going to go, but that's fascinating to me. You guys have to do so much more work just to treat that patient.
Yeah.
Their beliefs.
Yeah. And then the interesting thing is, just like most religions, there are gray zones and loopholes and things. So one thing that certain Jehovah's Witnesses will allow, there's this thing called cell saver. So like if a patient's having bleeding, as long as it's not infected blood or contaminated blood with poop and things like that, there's a machine where you suction the blood. It goes into this tubing into a pump, filters the blood, and then you could immediately transfuse that blood once it's cleaned and filtered back into the patient. It's called Cell Saver. So, with certain cases, with certain surgeries, like certain liver surgeries where it's going to be a very bloody surgery, they'll do Cell Saver and allow the blood to go back into the patient.
That is really interesting. It sounds very expensive.
Yeah, I guess. Yeah. But so Jehovah's Witnesses, some will accept that. And the interesting thing, here's a great segue, is so patients who are getting liver transplants, during the liver transplant surgery, they use Cell Saver to save the blood. Do you understand where I'm heading with that?
Well, yeah, I was figuring you might know. There was another death, a celebrity death, this time a lot younger, because Gene Hackman was 95 and his wife was 64. Michelle Trachtenberg was 39. She was found in her New York City apartment. And I you might know her from Harriet the Spy. Did you watch? Maybe that your kids were too.
No, I know her and loved her from the Ice. Was it Ice Princess? It was Ice Princess. So so I still remember watching that movie in Mammoth with my kids. One of the first times we were at Mammoth, on like DVD or something like that, and thinking, what a great movie, what a great actress. And so that's what Michelle Trachtenberg is to me, is my kids as young kids going skiing. That's what she was to me. So when I heard she died, that was sad for me, because I also grew up, ice skating and all that stuff, and it was an early memory of skiing with my kids.
I assumed you knew her from something. Apparently, she was like a Nickelodeon star. I mean, I knew who she was, but I don't think I'd seen very much, like Buffy the Vampire Slayer, Gossip Girl.
Right.
But yeah, apparently she had a liver transplant, I guess a year ago. I'm not exactly sure the date.
Which is nuts. And I even think I remember like having a conversation with someone, or maybe even my kids, about her, that she, kind of is in the same generation as like Lindsay Lohan and who went off the deep end for a while, even though I think she's back.
Yeah.
Thinking that Michelle Trachtenberg is going to be this great actress that's going to be around for a while. That's, the same kind of, cut from the same similar kind of cloth. And yet here we are hearing this past week about her death, which is also kind of a mystery.
It is. And so her family declined an autopsy, and the chief medical examiner's office, they said that's okay, and that the family can do that. So that's one of those ones that you'll never know exactly why she died, but that she did.
We won't know. The family may know, for all we know, the family knows.
No, for sure. That's what makes it, you wonder if it was drugs or alcohol, and that's why they don't want it public. Or, I mean, if it was,
or maybe she was suffering, and I believe they're Jewish, so maybe they come from it's possible it's a religious thing. Who knows?
That's true.
Having had a liver transplant, the fact that she had a liver transplant, that's, pretty serious stuff, and who knows how she was doing with that. And it's hard to say what exactly was going on with her.
Right. And I was reading about liver transplant. It says that there's a 5-year survival rate that exceeds 75%. But I mean, I don't know after that, like after 5 years, how long are you like?
No, I don't know the data. I haven't done liver transplant surgery for probably close to over 25 years. I haven't been involved in that kind of stuff, or maybe about 25 years. Maybe I scrubbed on a few back then. So I really don't know, but these days, survival is much better. Again, long-term, I don't know for sure. It takes me to, made me think about a book that I really liked. Did we talk about the book Cutting for Stone at all, by Abraham Varghese, who I would love to get on this podcast? That Abraham Varghese, Dr. Varghese, we want you I know you've been trying to reach out to us to be a guest on the podcast. We've been busy, but hopefully we could accommodate you. he's a physician, who was trained not in the U.S., I think originally, and then came to the U.S., but he's also a writer more than anything, I think. But the book takes place in Ethiopia, where I think he spent part of his life, or maybe even part of his medical training in Ethiopia. I'm not totally sure, and it's about this surgeon. And I don't want to spoil the book, but there's liver transplantation in the book.
Okay.
It's just it's a great, it's a really good book. It's kind of a slow start, but it really captivated me, and I could totally see that as a movie. And it's by Dr. Abraham Verghese, who's a big shot Stanford professor, I think, he's probably more of a, it's hard to say, is he more of an author or a doctor? Probably he's able to be a little bit of both. He also wrote a book called The Tennis Partner that's pretty wonderful too.
Both true stories?
The Tennis Partner was, I don't think Cutting for Stone is true, but I think he probably takes elements of his life to throw into that book, is my guess.
I feel like someone probably optioned it. Maybe they're doing something with it, but I'll look into it.
It needs to be a movie. We should find out. We should try to make it a movie. It could be, I could see it as such a phenomenal movie.
Okay. Yeah. So I was looking at liver transplants. I didn't realize this. So I guess 10,000 people receive liver transplants in the US. 24,000 are on like a waiting list, which made me wonder, have you ever put anyone on a waiting list? Have you ever seen that?
No, I've never, because you really, that's usually done by like a whole ancillary support staff for a transplant program does that. You go through, if God forbid you're someone who needs a liver transplant, you go through a whole health clearance and mental clearance. And then you have to make sure, unfortunately, a lot of the, one of the main reasons why people have liver failures from alcohol or drugs, possibly. So they really need to make sure that the patient is free of alcohol and free of drugs and okay before, getting that liver transplant. So there's a whole protocol in place before someone's cleared to get a liver transplant. The interesting thing about liver transplants is that you could have a living donor. Someone alive could donate part of their liver. You don't need a whole liver, because the liver could regenerate. Like a healthy liver could kind of grow. So it's pretty cool and interesting that like a living relative could say, hey, I'm willing to give you, it's not an easy surgery. And I don't know what the risk is to the donor. I don't remember anymore any of that stuff, although I used to know. But they could donate part of their liver, have a big surgery, and give part of their liver to someone, and both livers should regenerate. Wow,
that is cool. So that was one of my questions too. So if you do damage to your liver, it is reversible, or it's not?
Some liver damage is, sometimes it's not, sometimes it's beyond repair kind of thing. But sometimes, mild liver damage is repairable, and then the liver could regenerate and grow a little bit too.
Wow, that is really interesting. I knew there was like a team just based on like a transplant team, but I didn't know if you were ever like, I watched too many doctor shows, that if you were ever like trying to get a patient on that list, like I've seen in an ER episode, or you had any of those kinds of experiences.
No, but I've had patients, who, and I think I feel like I recently saw a patient. Oh, I saw a really interesting patient who came in with a woman maybe a year ago or so with a really uncomfortable, debilitating hernia in their abdomen, like in their belly button. And this patient had heart failure. And because their heart wasn't working, the fluids in their body were backing up, and the fluids were building in her abdomen. So she had all this, what's called ascites, building up in her abdomen, because the fluid's not staying in the blood vessels, it's leaking out of them. And, I don't know if you remember like those, whatever. So her belly was huge. Like she looked like she was pregnant, and it was tense, and it was hard, and it was uncomfortable. And she had this huge hernia, but she needed a heart transplant. And the amazing thing I said to her was, I said, you don't need hernia surgery. You need your heart transplant. And amazingly, she had her heart transplant. And then she comes in maybe 4 to 6 months later, looking like a totally different person, flat stomach, hernia gone, asymptomatic, because everything went back to normal. Her fluids went to where they were supposed to be, and pretty amazing.
That is so amazing.
Pretty amazing how the body recovers.
And now even like they're doing, heart transplants with like what, pigs? Like someone's still, I think, alive from the last transplant. I mean, they don't live that long, but they're finding ways.
Yeah, and the key, surgery is only one part of it. A lot of what keeps these patients alive is being on all these medicines, these immunosuppressive drugs that knock out the immune system enough so that this liver doesn't get rejected. And so the question, going back to Michelle Trachtenberg, is, could it be that somehow, she was rejected the liver, or and maybe that's what happened to her? Who really knows?
Yeah, I mean, that seems likely. And I don't know her. I don't want to be disrespectful. I don't know if it was alcohol, which is, like you said, it's like more likely that, liver transplants are because of alcohol, but they're also because of diabetes or fatty liver or
hepatitis or who knows, or just bad luck sometimes. Some people are born with polycystic, a disease called like polycystic disease, either polycystic ovaries, polycystic kidneys, polycystic liver, and that could be a reason. In fact, I recently talked to a friend who told me that they had disappeared for a while, and I reconnected with this friend, and the friend is like, oh, by the way, I had a kidney liver transplant. And the friend is doing great, thank God, and we've communicated a couple of times now. And this particular friend, totally healthy, but it turned out had polycystic. And what happens is these bubbles or balloons fill up the spaces of the kidneys and gets huge, and they stop functioning well. And so it has nothing to do with anything other than just bad luck. And maybe it's familial, actually, sometimes. So this friend of mine had a kidney liver transplant, and thank God is doing fine and back to work and doing their thing.
That's so serious. And he was able to find donors. That's amazing. I'm glad he's okay.
Amazing. It's amazing.
Yeah, I mean, I'm still kind of watching The Pit. I know you're not, but
we're watching it slowly. It's, in between all the other amazing shows, we've seen another episode or two.
Yeah, so I'm only used to seeing it in like shows and flashes. Like they're like, oh, they need a or they're organ donors, and then the team just comes in and disappears. So I've never seen a show about a transplant team.
Yeah. I don't know if it's just about that. I'm not totally sure either. The only other show, we're watching like a bunch of shows, because there are all these shows out now. 1923 is the one with Harrison Ford.
Right.
And in the most recent episode that we watched, the daughter-in-law, I think she's the daughter or the niece. I don't know if she's the daughter-in-law or the niece of Harrison Ford, gets bitten by a wolf, and they're worried that maybe she has rabies, and they get the doctor to give her a rabies shot, which was kind of interesting. And Bernice and I had to check. Bernice is like, no, there's no way the rabies vaccine was out already. And it turned out it had been already out in the late 1800s. And this is 1923. The interesting thing is the doctor doing it said, we have to inject it in your stomach, into your abdomen. And she's like freaking out. And we don't really know why, but then I had to fact check that. Like, why are they injecting it into the stomach? Why can't they just give it as a shot? It turned out, at least the vaccine that they had then wasn't so potent. So they had to give a lot, of stuff, and they wanted it to diffuse in. And they figured, I guess, in the stomach, they could give a lot of volume into the whole belly fat area, and it'll slowly dissolve. But it wasn't just one treatment. It was like at least 10 shots, every day or something like that, until hopefully, or maybe even 14, 10 to 14 shots of a lot of stuff into your stomach. But it worked.
She survived.
I don't know. We don't know yet.
Character? Oh, you don't know yet. Okay. But that's true with rabies today, right? Like you have to get a shot before the symptoms set
Yeah,
in.
you got to get a shot right away. But now I think I didn't even look. I think now it's just one shot, in the arm or the butt or something like that. It's not as scary, I don't think.
Wow. Yeah.
But that was an interesting medical fact check thing. And then interestingly, then I was like, when did the first vaccine come out? Do you have any idea?
No.
It was
I
for
like this rabbit
smallpox,
hole.
right? It was for small. Yeah, we started going down, and I learned about it. It was for smallpox. Guess what? Century? In the late 1700s.
Really?
Right?
No, I had no idea.
Yeah, it's amazing. It's like who would have remembered that? Like I learned it in school, but pretty amazing that the first vaccine in the late 1700s for smallpox.
Well, remember, we both watched, I think we got through the first season of like the Nick, the 1900 Knickerbocker. It seemed like in that show they didn't have anything. He was like doing surgery on himself. It was like craziness. So I didn't think
they had injections and
that's true.
Yeah. Good stuff.
Yeah, good stuff. All right.
All right, Lauren Taylor. Thanks for joining us, everybody, at Gross Anatomy.
Thanks. Bye.